Introducing Ipsen's Prefer study. Investigating the fertility of women treated with triptorelin during childhood for central precocious puberty, or CPP. CPP affects 1 in 5,000 to 10,000 children worldwide. The current standard of care for CPP are long-acting gonadotrophin-releasing hormone analogues, or GnRHAs. Previous studies suggest no major detrimental effects of long-term GnRHA use on fertility or the risk of developing hirsutism or polycystic ovary syndrome. However, these studies have predominantly been small-scale. The objective of the Prefer study was to analyze fertility in women treated with triptorelin 28-day formulation for CPP, both retrospectively for a 2-year period prior to study inclusion and prospectively during a 12-month follow-up period. Looking at the study design, Prefer was a questionnaire-based longitudinal, descriptive, non-comparative, epidemiological cohort study. Between February 2007 and November 2009, 248 women aged 18 or above who had initiated treatment with triptorelin 28-day depot formulation 3 mg for CPP in childhood between 1984 and 1996 were enrolled across 25 sites in France. The co-primary endpoints were 1. The proportion of women desiring pregnancy anytime before inclusion and during the follow-up period but not pregnant after 6 and 12 months of attempting to conceive. 2. The waiting time to pregnancy, or WTP, before inclusion. 194 women were included in the final full analysis set of Prefer, with an average age of 24.3 years and average height of 161.6 centimeters. The following results are all based on the full analysis set. At the time of inclusion, 45.4% of women either had no fertility problems or were unsure if they did. Pre-inclusion, 73.2% of women had never been pregnant, and 3 women reported not becoming pregnant despite wanting to. For the 62 pregnancies that occurred prior to inclusion, over 50% had been planned. 32 women provided information on wait time, which was less than 1 year for almost 85% of pregnancies. Prefer's retrospective analyses and follow-up analyses showed that 28.4% of women had at least 1 pregnancy before or during the 12-month follow-up stage. For women who were trying to conceive, 10% were not pregnant within 12 months of trying. Prefer found that most women with CPP who had received triptorelin during childhood experienced pregnancies within 1 year of trying to conceive, which is similar to women without CPP in France. As such, women who received triptorelin during childhood for CPP experienced similar fertility to the general population in France. These results from Prefer are to be consolidated through subsequent studies when the patients are in their mid-30s. There are some limitations of the Prefer study that should be noted as follows. Though 574 contact forms and sets of clinical data were collected, once all questionnaires had been collected, there were insufficient data to conclude on the co-primary endpoints. The proportion of women achieving pregnancy after 12 months was calculated on a small sample of 32 participants, which led to wide confidence intervals. 95% confidence interval, 67.2 to 94.7%. The Prefer study cohort included more senior management executives, employees and students, and less inactive persons than in the general population in France. This affects the analysis of fertility in this cohort, given the association between age at first pregnancy and level of education in France. Full details of the Prefer study are available on the Hormone Research in Pediatrics website.